Hi everyone, it's Dr. Gail. It is estimated that up to a third of women don't attend for smear tests. Sometimes the reason for this is that these women may have suffered abuse in the past or had bad experiences. However, a large proportion of women don't attend because they either perceive smear tests to be painful or uncomfortable or have had experiences that their smear tests have been painful or uncomfortable. So in this video, I will discuss some tips and tricks which may make smear tests less painful or less uncomfortable. The first tip is please don't attend for a smear test if you're bleeding or on a period, because if the person doing your smear test inserts a speculum and there's blood there, a smear can't be performed. So that would mean you had an unnecessary speculum examination. So number one, please don't attend if you are on a period. The second tip is to know the position of your cervix. Basically, the cervix can be three places within the vagina, either in the center, mid-cavity, or posterior, that means through the back, so towards the bum or lower back, or anterior or towards the front, towards the tummy or the bladder. Now, the cervix in most women tends to be towards the back. So when we're doing a speculum examination, that tends to be the direction in which we insert the speculum to point downwards and towards the back to visualize the cervix. If the cervix is in the front, for example, then it may mean a longer speculum examination to try to find the cervix before we realize that it's in the front and we've been looking in the wrong place. So when you have a speculum examination, if you have a smear test, it's useful to ask the clinician, where's my cervix? Is it in the front, is it in the back? And they'll let you know, so that you are armed with that information in the future that my cervix is either up at the top or down at the back or in the middle. So that just might save some looking around into the vagina, which can be quite uncomfortable. My second tip is choosing the type of speculum. Basically, there are two basic types of speculum. One is a metal speculum that you can see is opaque, and the other is a plastic speculum, which you can see is transparent. Now, some women prefer the plastic speculums anyway, because metal speculums can be a bit cold when they're inserted. But the other big benefit, in my view, of a plastic speculum is that when you're inserting the speculum, you can actually see through the blade of the speculum, so that you can sometimes see the edge of the cervix, so that you know in what direction to point the speculum, open it up, and you can see the cervix. Another benefit is that you can see the vaginal walls through a transparent speculum. So in women whose cervixes are hard to locate, sometimes a plastic speculum just makes it a bit easier because you have better visualization. My third tip is to choose the size of speculum. So speculums come in different sizes. So you can have quite small speculums and you can have larger speculums. This is a very small speculum called a virginal speculum, which would not really be appropriate to perform a smear test because it's just too small and you won't be able to get in far enough to see the entire cervix. There are also small, medium and large speculums, and there are also longer speculums. So if you have a smear test and it is successful, and sometimes we usually start with a medium speculum, that's usually the starting point. And if it is perhaps too uncomfortable for the patient or painful, or if perhaps the cervix is further away than the speculum will allow, then the speculum can sometimes be changed to a different speculum, either a smaller speculum or perhaps a longer speculum, depending on the patient. So if you have the experience where you've had a speculum examination and they've had to change the speculum to a different speculum, then please ask what speculum is it that you use, that you were successful with. So if the answer is I use a longer speculum, then in the future you can say, oh, when you go for the smear test, the longer speculum is better for me. And I'm sure the healthcare professional will be happy to use a longer speculum. So you may ask, well, why not always use a small speculum? If it's less painful or less uncomfortable. And the reason is that sometimes, because it's smaller, it may not reach as far as we need it to because the medium is a bit longer. Or when we open it, sometimes the vaginal walls can come in and we can't see. Most women tend to be okay with the medium speculum, so that's why we start with that one and we may amend as necessary. But more and more frequently, I'm starting to use smaller speculums because often you can get a good view, but it's not guaranteed. Larger ladies, if the cervix is really posterior or far back, then the longer speculum can be really useful. The other option is sometimes we use an adjunct to the speculums. So this is often for larger ladies because sometimes the vaginal walls can crowd into the view of the speculum, and we can use this sleeve over the speculum, which as you can see don't know if you can see down the speculum, but it keeps the vaginal walls out of view so that you can see the cervix clearly and perform the smear test. These may not be available everywhere, although they're a very good tool. Sometimes what we do is cut the finger off, tip of a finger off of a glove, put a glove with a speculum, and then we can use it in the same manner. My fifth tip focuses on your position during the smear test. So as I mentioned before, the position of the cervix can vary within the vagina, and sometimes just rotating the pelvis can make it easier to see the cervix. In fact, many times make it easier to see the cervix. And many of you may have been asked to, for example, make two fists and shove them under your bottom, which lifts the pelvis and can rotate the cervix into the view of the speculum. And that's a trick that I use really, really often, and it is very, very effective. So if this has been used before to do a smear test, when you go for your subsequent smear test, you can offer to sit on your fists or you can just sit on your fists. The other option that does a similar thing is to use a tiny bed like this, where the patient lays on the bed with the legs up. And again, that just rotates the pelvis so that the cervix more easily comes into view. And these beds are used quite routinely for example, colposcopy examinations, which I've discussed in a previous video. So that's it. We've got 5 tips and tricks, hacks that can make your smear test significantly less uncomfortable, less painful. And hopefully if you use these, it'll be a better experience for you. For most women, however, the experience is okay. So don't be afraid if you've never had a smear test or if you're going along for your first smear test. They're usually a well-tolerated investigation that, thank goodness, you don't have to have that often. But these tips may help encourage women to come along and have a smear test if you haven't had one for quite a while. If you've got any experiences you'd like to share with us, please do so in the comments, particularly if you've devised your own tip or trick for speculum examination or smear test, then we'd love to read about them. If you found this video helpful, please like the video, subscribe to my channel because there'll be more content like this coming out just to encourage women's health and encourage women to come along and see a gynecologist. Thanks for listening. See you next time.